Hey everybody, and welcome to The Explainer. Today we are digging into something that I bet feels, well, pretty familiar to a lot of you. That frustrating, confusing disconnect in our healthcare. We're going to be looking at a fantastic article by Dr. Victor Andrade that really puts a name to this problem, and even better, lays out a powerful idea for how we can start to fix it. Seriously, just think about it for a second. Your doctor, your specialist, the pharmacy, your insurance company, it's like they're all playing on the same team, but nobody's ever met each other. And you, the patient, you're stuck in the middle, running around like a messenger, trying to connect all the dots yourself. It's exhausting, right?
And this slide, this really gets to the heart of it. On the one hand, you have our expectation. You walk in hoping for this seamless, coordinated experience where everyone's working together to keep you healthy. But the reality is usually the total opposite. It's fragmented. You're repeating your medical history for the 10th time, and the whole system just seems to react to problems after they happen instead of, getting ahead of them.
So what's the official diagnosis for this mess? Well, Dr. Andrade gives it a name: healthcare's Great Disconnect. And it's not just a series of small glitches. It is a deep, systemic problem.
According to Dr. Andrade, the root cause boils down to just one word: silos. Picture it. You've got the hospitals in one giant tower, the insurance companies in another, the pharmacies, the tech startups. They're all part of the same city, but they're walled off, operating in their own little worlds, barely talking to each other. And let's be clear, these silos aren't just a minor inconvenience. They have massive, real-world consequences. We're talking about huge inefficiencies, tons of duplicated tests and paperwork, and sometimes even dangerous delays in getting the care you need. It all drives up costs for everyone, and at the end of the day, it just chips away at the quality of care that we, the patients, actually receive.
Okay, but it is not all doom and gloom, because once you diagnose the problem, you can find the cure. And Dr. Andrade argues this diagnosis points us toward a really powerful prescription for the future, a big idea he calls innovate together.
This quote right here is everything. The solution isn't about trying to make each silo work a little better on its own. It's about building solid bridges between them. The future of health isn't about isolation. It is all about connection.
And this is the big aha moment of the whole piece. For so long, we've been looking for the next big thing to happen inside the hospital or inside the insurance company. But that's not where the magic is. The real game-changing innovation is going to happen at the interfaces, those critical connection points where these different worlds finally meet.
So, the big question is, how do we actually do it? How do we build these bridges and start innovating in those in-between spaces? Well, Dr. Andre lays out a super clear, three-part prescription to get us there. Okay, so here's the game plan. It's a three-pronged attack. First, we have to actively start knocking down those institutional walls. Second, we need to completely flip the script on what our healthcare system actually rewards. And third, we've got to use technology as the supercharger to make it all happen. Let's break each one down.
All right, step one starts with this kind of techie-sounding word: interoperability. But don't worry, all it really means is getting different computer systems to actually talk to each other in the same language. It means your doctor's records can be instantly and securely understood by your pharmacy system. It's basically the plumbing. You gotta have it for anything else to work.
Step two is all about the money. For decades, the system is run on what's called fee-for-service. Basically, doctors and hospitals get paid for the number of things they do. More tests, more procedures, more money. The big shift we need is to value-based care, where we reward good outcomes. It means we pay for keeping people healthy, not just for treating them after they get sick. It just makes sense, right? And finally, step three is where technology becomes the engine for all this change. And we're not just talking about a new app on your phone. Think bigger. We're talking about using AI to predict disease outbreaks, to cut through hospital red tape, using telemedicine to bring top-tier care to people no matter where they live. Technology is the tool that makes all this collaboration possible. Okay, so this all sounds great in theory, but what does it actually look like in the real world? Let's check out some examples of where this collaborative future is already starting to happen.
Yeah, this is not just a fantasy. As Dr. Andrade points out, countries like Denmark and Singapore are already showing us the way. They've been working for years to integrate their health services, their data, their financing, and the result? They can spot public health threats earlier and respond way, way faster. It works.
Dr. Andrade then brings this idea home with a really cool proposal for occupational health in Mexico. Just look at this. When you connect platforms for workplace health with hospitals and insurers, everybody wins. The workers, they get preventative care and get healthy faster. The companies, they see less absenteeism, more productivity. And the health system, it reduces the crushing load on emergency rooms. It's a true win-win-win.
But, and this is maybe the most important point of all the fancy tech in the world isn't going to fix this alone. This isn't just a technical problem. It's a human problem. The biggest change we need to make is a fundamental shift in culture.
So what does that look like? Well, it looks like building real, actual trust between organizations that have always seen each other as competitors. It means having clear, transparent agreements. It means having a shared vision of what a healthy population actually looks like. And maybe most of all, it takes strong, empathetic leaders who are willing to build those bridges, not more walls. And that really brings us to the final thought to leave you with. When we think about our own healthcare and the future we're building, the most important question we can ask is this one. Are we building a system of walls, or are we building a system of bridges? Because as Dr. Andrade so clearly shows us, the answer to that question is going to determine the health of every single one of us. Thanks for watching The Explainer.